Good afternoon. It's my great honor to be here and share some of our experience in Wuhan. And I'd like to take this chance to give a short introduction on the management of critical ill patients of COVID-19. Why I choose this topic? Because the effective management of seriously ill patients is the core of all clinical treatment. COVID-19 has become a global public health problem. And you see many patients infected in the worldwide, and some of them have deaths. And thanks to government and to take very effective measurements, now in China, and COVID-19 is completely controlled, and about 4,643 patients were died. According to the arrangement of the National Health Commission of the Chinese, at the beginning, works in Wuhan was kind of hard. There were many serious cases in the hospital. Besides, because the inpatient ward was temporarily transferred from a common department to the infectious ward, conditions are relatively poor. Short-handed troubled us a lot because the most person was quarantined. So we tried to ensure the quality of our medical care in such poor condition. First is to take close observation on patient's condition, and then to adopt precise adjustment on the treatment, and also to ensure the nursing quality and to give living care of our patients. The last one, which is also of vital importance, is to take holistic care of our patients to alleviate their pain and loneliness. To my delight, after our careful work, several days later, vast majority of our patients went out of danger. However, such an improvement shouldn't be limited to our ward. I think about one thing, how to lower the deaths of the hospital. We established a death rate lower group, and my suggestion, the group would discuss all death cases every day, analyze their cause, review the whole treatment process, and finally give our professional advice. The great results were achieved pretty quickly. Here we can see the highest death toll was 8 per day before. All group was assembled on February 16. Only 3 days later, there was a 3 days period of zero deaths. And another 6 days later, we saw 0 deaths for about 1 week. It is quite a stable trend during later period. And some cases were caused by other disease like myocardial infarction instead of cancer. Here list the 5 characteristics from our patients. The first, most death patients are old patients, especially those patients with chronic disease, that's like diabetes and coronary disease, and so on. Also, these patients stayed out of the hospital for more than 10 days. The interval between hospitalization and tracheal incubation was more than 7 days, and they almost all died within 24 hours of tracheal incubation. According to our discussion, we tend to believe that such a short period of 24 hours is mainly due to too late to do the tracheal incubation. Later on, the interval between tracheal incubation and the patient's death prolonged to 7 days. We think it might be improved by the advanced tracheal incubation. Bad patient management may also help. For such patients, the most death cases are results of other reasons like infection and hemorrhage and so on. Based on above results, I concluded the following advice for the treatment of critical ill patients of COVID-19. First of all, we should prevent patients block the pathway from mild to severe patients. For the second one, we should move key treatment forward. For example, adopt endotracheal incubation earlier. It may support patients' breathing. ECMO is of the same reason. The most concerned patients should be first all the patients, especially those with diabetes, heart failure, and cardiac disease. The second is the patient with serious pulmonary, and also the patients have the cytokine storm. And finally, I wanted to show a special patient, the patient in our hospital in Xi'an. The patient is a female and 66 years old. Now you see patients come to the hospital on February 5. And in February 6, we give the non-invasive ventilation. And 1 day later, give the and on the February 7, give the invasive ventilation, and February 9 to give the ECMO. And just because of the very early treatment, the patients recovered for about 46 ECMO treatment. So this is what I wanted to talk and how to treat the patients with the ill severe patients of COVID-19. Thank you very much.